Hello and welcome to another episode of Doc Talk Beverly Hills. My name is Ariel and we're here again with Dr. Katzen, board certified plastic surgeon. Hello.
Hi, Ariel.
So today we're going to be talking all about plastic surgery myths. Now there's a lot of myths and misconceptions about plastic surgery. Why don't you mention some of the top ones and we'll just go down the list and I'll ask you some questions about them.
All right. So there's a common myth that all plastic surgeons are equal. And there's a little confusion of, plastic surgeons and cosmetic surgeons. So plastic surgeons are certified by the American Board of Plastic Surgery, and they go through a rigorous training. They go through typically anywhere between 2 and 3 or up to 5 years of general surgery training, and then plastic surgery training on top of that. They take a lot of tests, they take an oral exam, and if they pass all those, then they are certified by the American Board of Plastic Surgery. It's one of the few boards that's certified by the American Board of Medical Specialties, and you're able to call yourself a plastic surgeon. A lot of other fields can call themselves legally cosmetic surgeons. You can be a OBGYN, you can be a dermatologist, you can be even a pathologist or a pediatrician and still call yourself a cosmetic surgeon. There's no trademark on the name cosmetic surgeon. But to be legally a plastic surgeon, you should be certified by the American Board of Plastic Surgery.
So there's a difference between plastic surgery and cosmetic surgery.
Correct. So cosmetic surgeons, typically you can buy a membership in a college and call yourself a cosmetic surgeon. You can go to a course over the weekend and call yourself a cosmetic surgeon. And overnight, you can change your practice from perhaps pediatrics or OBGYN, and overnight, on Monday morning, you can now call yourself a cosmetic surgeon and completely change the nature of your practice.
Okay, so just double check with who you're seeing.
Yeah.
And you typically would like to go to a board certified plastic surgeon.
Board certified plastic surgeon. And the way you can check, it's very easy. You go on to the American Society of Plastic Surgery and their website will come up. And then within that window, it will say, check to see if your plastic surgeon's board certified. And you go into there and you can check their name on that website.
Okay, so that's one of the myths. Another one is that only wealthy people can afford plastic surgery.
Yeah, that's not true at all. So in the past, perhaps, maybe, plastic surgery procedures were so exorbitantly expensive that average people could not afford procedures. Now, there are so many plastic surgeons that the price has significantly come down. So there are plastic surgeons within the US, there are plastic surgeons worldwide. The access to plastic surgery is there. It is no longer just restricted for the uber wealthy or the very wealthy.
Kind of like computers before only the
Exactly.
wealthy people.
Exactly. So yeah, before, only wealthy people.
Cars, yeah.
Cars, yeah. So cars, everything sort of comes down and then reaches sort of an equilibrium. Yeah, you can get very inexpensive plastic surgery. I wouldn't advise it. Don't go for the cost. Go for the procedure that you can afford with the person that you trust that is the most qualified, but don't go for the least expensive, please.
Mm-hmm.
Another one is only women get plastic surgery, and that's not true either. Depends on your demographic. I have a very good friend, and all he does is male plastic surgery. He doesn't have any female clientele. All right. I have another plastic surgery friend who all he does are female patients, doesn't do any male patients. So it depends on your practice. Me, about 80% of my patients are female, about 20% male. So it really depends on your mix and what you're doing. If you're doing breast augmentation, the majority of your patient clientele are going to be females. Okay, not entirely. If your majority of your practice is maybe vaser high definition sculpting of the abs, a large majority of your patient population could be male patients. Just depends on it just depends on your demographic and the specialty of your practice.
Okay, great. And let's go into other myths like creams, magic lotions and potions that make cellulite go away, that make scars disappear.
So that goes back like almost 200, 300 years, where you have the person selling snake oil saying, oh yeah, this will get rid of wrinkles, this will make you 30 years younger. Just be careful out there. There's a lot of stuff out there, and we always get it in the office almost every day. Oh, in Europe, they're doing this and they're showing this. I'd be very wary. So, and especially now with the advent of and the promotion on social media, people selling potions and lotions and the Photoshop ability of a lot of these pictures being altered, you don't know what's what. So I would trust board certified MD doctor, plastic surgeons, maybe dermatologists that are experienced with these products and have proof. But if you're just going out there on Google and other search engines and looking for products, yeah, you're going to find them, but they may not necessarily work because they haven't been studied by the US FDA and maybe these other practitioners that can almost guarantee that these products do work. So just be careful.
Yeah, I mean, have you ever heard of a cream that actually got rid of cellulite, for example?
No.
Right, because if it existed, we would have it.
Exactly, and there would be one or two of those products, and after about a couple of years, it would become generic, and that'd be that. So cellulite, stretch marks are another one. You always see about 100 or more, way more, products that can treat stretch marks, but they don't, because if we had one, we'd all use that one.
Yeah, all kinds. Like they say, your scar will be completely gone, your scars will never disappear.
Yeah.
Yeah. Another thing is that people often don't know how to manage their expectations going into plastic surgery because they'll see these celebrities who, have this hourglass figure that they want to achieve and they think a BBL will do that for them. But they have to realize too that, with Facetune, which is like an editing app, they're so accessible these days that you could easily make your waist go in by 5 inches just by going bleep bleep on the phone, on an app. So people have to be realistic and know that, our body types are different.
Yeah.
Do you tell people this all the time?
Yeah, so it's very important for you to have realistic expectations after the surgery. I mean, you are not like your sister or your friend or your friend's friend or a picture on Instagram that you saw before and after pictures. Everybody's different. And you are different. And not only that, your plastic surgeon is different. And the day is different, so that means on one day your plastic surgeon is doing this, and on another day they may be doing that. So your results could be a little bit different from day to day. Also from the swelling and the healing and everything like that, the results do vary widely.
Yeah, and just don't always believe what you see on social media.
Yeah, be highly suspicious. In fact, when I'm on social media, I often do not believe what I see as opposed to believing what I see. So just take everything you see out there with a grain of salt. If you're seriously considering that procedure, visit with the plastic surgeon, ask to see before and after pictures, maybe even see some of their patients, physical, one-on-one.
Right, and also if patients submit reviews with photos in it, that's often a really good way to know too.
Yeah, so patients that submit their own pictures. Now also there's a little bit of variability in that when we take pictures here in plastic surgery office, there are certain poses and standardized lighting. So everything is standardized. So we take a profile shot with the lighting over here and the flash over there and the height of the camera here and there. So we try to standardize everything. When people are taking selfies of themselves before and after, they can alter the position and they can do no plastic surgery whatsoever and they can look dramatically different by sucking in their stomach or bulging out their cheek or the lighting or the flash or the apps. So just be very careful on your analysis of the before and after pictures.
Oh, it's so hard to tell these days.
It's unfair.
Too many factors.
Too many factors, yeah.
Okay, another myth is that it's all about vanity. People only do this because they want to look so good. Let's talk about that.
So that's not necessarily true either. A majority of my practice is after weight loss. So patients lose hundreds of pounds or even more and have rolls and rolls of skin. So there's no way, no amount of exercise and dieting that will get rid of those rolls of skin. So the only way to get rid of those rolls of skin is by making an incision and cutting that out. So that's not really a vanity issue. That's getting rid of excess skin and fat. So by far the majority of my patients are not doing it necessarily for vanity. They're doing it more for function. Okay. Another large factor of my practice is removing silicone. So they may have had the silicone initially injected for cosmetic reasons, but now they require that tissue that was injected to be excised, removed, because the harmful consequences is causing not only the tissue, but also functionality, they're not able to do certain things, and because of localized pain. So they're not having the procedure done because of vanity, they actually need the procedure done. So these are procedures that we do in plastic surgery, not because of vanity, because people really need it.
And then sometimes it's like people have to undergo a procedure like, is it called a mastectomy?
Yeah, true. Unfortunately, a lot of patients develop breast cancer and need mastectomies where we're taking either part of the breast out, partial mastectomy, or total mastectomy where we're taking the entire breast tissue out, as well as breast skin. And then we have to reconstruct the breast with implants, with soft tissue, to get the breast reconstructed. So those are more reconstructive plastic surgery. Those are not really vanity issues.
And they just want to be returned to how they were once before.
Exactly. So those types of patients, basically they want to be able to walk into a room and just be able to fit in with the natural crowd. They don't want to walk into a room and go, whoa, you had plastic surgery. They just want to be able to assimilate and basically become part of the crowd.
Why do you think there used to be a negative stigma behind the name plastic surgery?
Yeah, probably a variety of reasons. Maybe there was bias towards the very uber wealthy. Maybe they were sort of viewed as sort of untouchables, and you could only have that because you're only able to have that because you're so wealthy. So there's a little bit of a snobism from that. A lot of people view it as very foo-foo, very sort of, oh, you don't really need that. But the plastic surgery that I do, I think patients do need. I think patients do require this after the significant weight loss and after these silicone injections.
Yeah. And I also think that certain TV shows out there, kind of put a misconception in our minds that like, oh my gosh, there's a really good chance that you're going to get botched or you might even die from this surgery. Because a lot of times what we see in like the news and stuff is the worst of the worst. It's the bad cases.
True. So yeah, so in the news you'll get just that. I mean, you'll hear about the horror stories, the 20-year-olds that had a breast augmentation or a BBL, fat transfer to the buttock, and they died. You don't hear about the millions of cases of successful breast augmentations. You don't want to read in the news, oh, 28-year-old patient had a wonderful breast augmentation.
Why would anyone,
Boring news. You don't want to hear about in the newspaper, oh, 32-year-old patient had 4 liters of fat aspirated and 600 cc's successfully put in the buttock. Boring. People don't care about that. They want to hear about unfortunately, the terrible and sad news now, and a lot of our news media is sort of focused on the tragedies of life, not the successes.
We hear all the bad stuff about it, not all the good stuff, so those aren't really accurate ways to measure if surgery is safe or not.
Correct. So by and large, the plastic surgery procedures that we do are safe. By far the majority, 99.9% of patients do fine and do not have issues.
So there's a lot of myths out there, but if you have any questions, you should probably talk to a board-certified plastic surgeon about it because they would know best.
Yeah, unfortunately myths get sort of intertwined with our thoughts and our daily opinions about things, and sometimes they get embedded and sort of stuck there, and they're hard to extract. So, if you've thought about plastic surgery, but you've not sought it out because of one reason or another, maybe just consult with a plastic surgeon. A lot of consults can be made for free or even online. So you at least talk about your thinking about plastic surgery, and maybe we can help to allay some of those fears and myths.
I also feel like as the new generation is coming up, people are more open to things and like more willing to hear, because when I talk to my aunties and uncles, they're like, why would anyone get plastic surgery? I don't understand that. That seems like a risk why would anyone take that,
Sure.
And they don't really understand, and I'm not sure if it's, because of their age or just because of, the stigma behind it.
Right.
But it's kind of hard to talk to certain people. So if you're out there and you feel like your family or your loved ones don't understand, that's kind of a common issue that patients deal with sometimes.
Sure, absolutely. I mean, there are a lot of cultural taboos against plastic surgery. There are a lot of older patients that are very against plastic surgery. So you get a lot of that. Also, in the weight loss community, a lot of my patients who had previously been obese, a lot of their family members are obese, a lot of their friends are obese. And then when my patients get the weight loss surgery, and then the plastic surgery, reconstructive surgery on top of that, they look fantastic and amazing.
Yeah.
And they lose their friends who are still obese.
I feel like.
Yeah, they feel kind of jealous. They lose even family members. They don't want to talk to them anymore because they've gone through this transition. So often it's very sad that these patients go through the weight loss surgery and then the plastic surgeon look amazing, and then they lose friends because of it.
It's sad. This should be more seen as motivation for themselves.
Absolutely.
Yeah.
So reward. But everybody's a little bit different. So just if you've heard things that may turn you off to plastic surgery, those may or may not be accurate. So if you're thinking about plastic surgery, give me a call.
Yeah, and I also believe that just the name plastic surgery doesn't do you guys justice, because people could relate to like plastic, oh, looking like a doll. And also we see the very extremes on social media sometimes where people have, you know, these implants that are just way too big for their bodies and it's uncomfortable. And then of course there's horror stories about those too.
Sure.
So everything with a grain of salt. Not everyone's like that. Plastic surgery is not turning you into a doll unless that's your goal, which, you know, some people specialize in that.
Yeah.
Not really us.
So plastic surgery came from the word Greek, plastikos, which means to mold. So mold surgery is plastic surgery. So in plastic surgery, we're molding the body to get what we want. It doesn't necessarily mean we are inserting plastic here and there. It just means we're using your tissues to mold and get to sculpt and to get the ideal thing that we want. So whether it's the skin, whether it's the bone, whether it's the soft tissue, whether it's the fat, to mold the body to get the results, the shape, the aesthetic, the functionality that we need and want.
Oh, one last thing is that a lot of people might think that they're too old for plastic surgery.
Yeah, so it's not really an age question, it's a health question. So I have some patients who are older, in their 80s, and are very healthy, and we can do plastic surgery for them. I have some patients who are younger, in their 20s, and they've got multiple medical issues, hypertension, uncontrolled diabetes, they smoke, etc. We're not going to do the plastic surgery because even though they're young, they're unhealthy. So it matters more on your health than your age.
Okay, great. So we went over just a few myths that we know are out there, but if you guys have any more questions about other myths, please give us a call. And don't trust everything you see out there.
Yeah.
All right. Do your research. All right. Thanks for tuning in, and you can contact Dr. Katzen at
310-859-7770.
Or you could DM us on Instagram at Dr. Katzen MD. All right, we'll see you next week.
Thanks.
Thank you.